I know if I'm a good candidate for breast augmentation?
Breast augmentation is a surgery for women older than 18 years of age for saline implants. For silicone is usually 22 years of age or older, and providing they're healthy with no significant past medical history, and that they have that they want to do this procedure because usually they have a small breast. So a lot of people become really a candidate for this procedure.
If I am a good candidate, how do you know what best size fits my frame?
Well, it depends of what the patient wants, but also depends of the patient measurements, thorax, the measurements of her thorax, the trunk, measurement of the width of the breast, the tissue characteristics of her breast, and the amount of thickness of tissue that they have.
And do you use saline or silicone implants?
Well, the choice of implant, the kind of implant, whether it is saline or silicone, it's basically the woman's choice. I really don't have strong preference for one or another unless there is a particular scenario. In other words, implants, saline implants, they're different than silicone, obviously, but some patients might benefit for using silicone instead of saline, and some other patients may be better candidates for saline. A silicone implant is filled with silicone polymer, which essentially is more viscous than water. Water is or saline solution. In this case, a saline implant. Either saline or silicone implant would be most appropriate for almost everybody else, for every woman. Now, in some instances, silicone will be best in women who has very thin tissues, and the risk, even if you place this under the muscle, the pectoralis major muscle, there is less risk of rippling with silicone, and essentially it's basically the woman's choice. Both implants are FDA approved. One is more expensive than others, but they're both good. If I have to say anything about the silicone, is that it feels more natural.
Do you recommend over the muscle or under the muscle?
Most implants are placed under the pectoralis major muscle for protection. The implants are more, they have more tissue to be protected, and there is less risk of capsular contraction when we compare it, especially in the saline implants.
If you go under the muscle, does that affect my mammography results?
For mammography, is better to be under the pectoralis major muscle. So to prevent, the question is, what do I do to help healing when I'm healing after a breast augmentation? I'll say, well, obviously, don't do anything that would inhibit healing, such as smoking and refrain from heavy exercising at the beginning of the first few weeks. The recovery time after breast augmentation, I would say, is only a few days, probably a week. But healing takes a long time. Complete healing takes a long time, and the breasts change. But after 3 months, you will see more or less what they are going to look.
Health Matters will be right back.